But there are some other days that you can't do but talk about them. I mean, there are days like International Day of the Women's Day, International Day of the Girl Child, and all of those things, because there are a lot of people who are doing amazing things for the women. So it's always very pronounced when you're talking about the women. And I also want to, raise other conversations this morning. It's not just about talking for them. It's not just about, shaping conversations for women. There are lots of interesting people who are also making products, doing some digital disruptions for the women. And they're not just doing it for they're making innovations. They are doing cutting-edge digital platforms in the interest of women. And it's always good when we talk about it. It was last week we were talking with the Tech for Dev representative. I had a blessing with me on that show, talking about how they allow women enjoy certain leeways when it comes to getting them involved in technology. And now there's another platform. They are a cutting-edge mobile-first digital health platform, and their aim is just to revolutionize maternity, reproductive, and prenatal care for women. And I understand from the last research I did about them, they are targeting almost 300 women in Africa alone. I mean, you know what it means for when you're bridging the technical divide, you're bringing out mobile apps for the interest of women. You want to, you want to cover that cultural stigma, misinformation. They have access on their palms to quality treatment and all of those things. I mean, it sounds interesting. Yes, this morning we'll be talking to Felix Bomide. He joins me virtually this morning, and it's going to be talking VivaFemini. Top of the morning to you, Bomide.
Top of the morning, Josh. Good morning to you, and good morning to our lovely listeners out there. Can you hear me?
Yeah, very loud, very clear. Like they say in the military balance, I read you, Lima Charlie. Now, we were still talking about the National Day of the Girl Child just last week. Every other day we do Mothering Sunday, Happy Women's Day, we do Day of Girl Child, we do Day of the Female Gender, we do Day of the... I'd like to put this question to everyone. Are we not bothered that the male gender, one way or the other, are being sidelined in all of these things, Mr. Bomide?
Well, absolutely. You're right. We should be catering for all genders, whether boys, girls, men, women. I mean, health is universal, isn't it? So I completely agree with you that we need to also factor in men's health into the care for the general public. But I would say that men are not outrightly sidelined. I think across the globe, particularly in Nigeria, we are quite open to catering for people of all gender. Healthcare professionals are open to caring for everybody. So the same way Julius will come into the hospital, he would receive care. Same way Chinyere will come in and still receive care. So that's what I can say.
Talking about care, there has been some recent conversations. I watched the social media about overt attention being paid on the woman. For instance, the woman was just giving birth, and nobody cares about the man. Talking about the man's mental health, everybody's just greeting the woman and the new baby. They just want to ask about the woman's health, and men will go days without eating because the wife has just given birth, and all the attention is on the women. Are you bothered about that?
Well, I would say that I don't think people necessarily want to ignore the man, but women go through a lot when it comes to childbearing. And I must say that childbearing is not an easy episode. And if we turn the hands of time and we say men should be involved in giving birth, I doubt if any man wants to go through this.
Speak for yourself. I don't want to go through it. I don't want to go through it.
I mean, I have personally witnessed, I've taken deliveries because of my career. I've been in the labor room, with my wife, when we had our kids. Right. And I've also, the pain is excruciating, definitely. Right? And so I think women deserve all the attention. I think they deserve all the care, every attention that is being pointed towards them, particularly after giving birth or before giving birth. I mean, the woman deserves a spa.
I agree with you 100%. I agree with you 100%. Now, since we're talking about childbearing and all of those, unfortunately, Nigeria leads in a particular statistics when we're talking about maternal mortality. If not the highest, we are one of those that we are bedeviled by that cancer called maternal mortality, like I like to call it. Now, there have been numerous campaigns, advocacy, and all of those things to try to reduce this cancer called maternal mortality. Yeah, it's cancerous because it has eaten so deep into the fabric of our society. Now, you have certain interventions that you're doing, and I want you to talk about it. Your own digital health platform. What are you doing differently to address this in your own little corner?
Well, thanks, George, for bringing that question. And that question is timely because, unfortunately, Nigeria still has one of the highest maternal mortality rates across the globe. In VivaFemini, we understand that the MMR, which is maternal mortality rate, has different causes, factors, and we are head on with the solutions because our platform is being built to provide solutions to these causes. One of these causes of maternal mortality rate is the lack of early detection and the delayed access to care. We know that oftentimes many women, particularly those in less urban areas, face delays in deciding to seek care, probably reaching delays in reaching a health facility, receiving adequate care once there, and all these myriads of factors lead, come into this lack of early detection. That is where VivaFemini steps in. With VivaFemini, we have our early risk detection and timely care, which includes digital screening, symptom checkers, red flag alerts that connects clinicians to our users within minutes, such that the concerns that is associated with early detection is mitigated. We also have a platform or a system in VivaFemini called the C2C Bridge, which is the use of our ambassador network, our seamless referrals, social media referral systems that directly address these delays caused, which leads to MMR, increase in MMR, and bringing awareness and access closer to women. I mean, there's no point why a 26-year-old lovely lady in the banking sector would die because she lacked access to early detection of concerns around her pregnancy. One of the other causes as well is poor adherence to ANC, antenatal care, and postnatal protocols. We know that oftentimes, inconsistent attendance, at ANC visits, the failure to follow medication regimen sometimes, and even missed postnatal checkups could make critical health issues go unaddressed among our women. And that is one of the solutions that we're bringing into VivaFemini. We have our ICP called Integrated Care Pathways, which includes guided care plans, appointment scheduling, automated reminders, lab integrations, and continuous education. This is really important that I stress this here.
Okay.
And our continuous education is quite bite-sized, it's culturally relevant health education that ensure all women are consistently guided throughout their pregnancy journey, right? Improving adherence and their health outcomes when it comes to pregnancy. Another cause that why Nigeria has, increase in the MMR is also limited health literacy, and inadequate health-seeking behavior. We have this situation whereby women, some women lack, or many women actually lack sufficient knowledge about pregnancy danger signs, risks associated with nutrition, hygiene, the importance of, SBAs, leading to preventable complications or later presentations at facilities. And that is where VivaFemini also comes in. Our CE tool, which is our continuous education tool, is delivered in local languages, the languages that is being used in Nigeria, Yoruba, Igbo, Hausa, even in Pidgin, right? And when we scale up to countries across West Africa and Africa, we will cater for top-speaking local languages to ensure that our platform, Health Information Library, is culturally tuned and provides that rich content that helps to reduce the maternal mortality rate in Nigeria and in West Africa and Africa as we scale.
Mr. Felix, let's just break it down for that. Now, what VivaFemini is doing, is it that they are providing a contact where can call when they need all of this health education and awareness? Is it a phone number? Is it a website? What is the specific solution that VivaFemini is about? You just want to tell us what VivaFemini is about exactly?
Fantastic. Thank you very much. I wanted to say that you're not coming to that for me to stress about VivaFemini. Well, I like to describe VivaFemini as an all-in-one ecosystem that is designed for women from puberty up until aging. And when I say all-in-one ecosystem, it includes tools like tracking of their health. For example, reproductive health, menstrual tracking tools, pregnancy tracking tools, fertility, wellness, symptom checkers, whereby individuals are able to track what goes on in their health, from reproductive health up onto sexual health, up onto physical health, up onto general health management. And from this tool, from these tracking features, they are able to access clinicians or access licensed and vetted healthcare professionals.
Interesting.
Through our telehealth platform. Yeah, so we have a telehealth feature whereby when you have all these symptoms and you feel, oh, this is not right, and you want to speak with the clinician, all of our clinicians are vetted. They've all gone through the clinical compliance safety protocols. They've all gone through the rigorous process of onboarding to ensure that our users are safe in their hands and that they are providing the best and optimum care to our users. So we have a telehealth feature in our platform.
Right.
The third bit there that users would enjoy with VivaFemini is our safe, anonymous, discreet, well-packaged community forum, whereby individuals are able to come in, interact, using our platform to speak with themselves. They could create a forum, they could ask questions from our vetted clinicians, and these questions are also moderated. We want to ensure that women are safe when they are having conversations that pertains to them.
Right.
We're not just building VivaFemini as another amorphous tool. We are building it in such a way that everyone that comes into our community forum, they are able to get answers to the questions that pertains to their health, and such answers are backed by science and backed by clinical evidence and judgment.
All right, Mr. Bomide, now I like the discrete parts, because when it comes to health, a lot of us just want to, talk to just one person. We don't want to talk to a family member. We don't want to talk to a neighbor. We just want to talk to maybe one faceless person that we trust, that understands all of these things. And I like the fact that that part has been addressed. But now, I'll put it to you again. Is it like a SaaS platform? Is it like a website? Or is it, because you keep saying tools, because I want the person listening to understand how they can actually get access to all of these lofty innovations you've talked about. How can they actually get access to it?
Well, thanks, George, for bringing that out. Yeah, it's not just a tool. It is an app. So we are currently in the phase of building the VivaFemini app, whereby people can download it from Play Store and Apple Store in the next few weeks. Our target launch date is the 12th of January 2026 with phased rollout. So the VivaFemini mobile app will be out there, where users download, our lovely women download this app, and they are able to get the solutions they want. Also, we will be having a web app that caters for our healthcare professionals, where they are able to have telehealth consultations, amongst other things that will be on our web app as well.
Awesome.
And to buttress my point around privacy and security and compliance, we are ensuring, and VivaFemini will stick to data privacy consistently and rigorously to assure every user of our app, our lovely women out there, that we are not just out there to provide general services, but that their data is secure with us, and most importantly, they are getting outcomes or solutions to the problems that they've come. They want to find solutions from in using our app.
Now, Mr. Bomide, you said something about the telehealth feature. Are you telling me now that there are certain health facilities that you're partnering with? Because we are dealing with a lot of things when it comes to our health sector these days. We are dealing with the fact that doctors are not enough, personnel are not enough. This one wants to jackpot and all of those things. Are you partnering with real doctors, or it is AI that I'll be interacting with when I go on the telehealth feature?
Well, let me just pause that myth there. No, it's not just AI. We are partnered with real vetted licensed clinicians.
Oh, nice.
And not just medical doctors. We have also nurses, midwives. We have therapists, on our platform, clinical psychologists, and a myriad of healthcare professionals that are vetted, licensed, and work within their scope of practice to ensure that solutions are provided to our women. Because just like you mentioned, maternal mortality, we also know that some women even struggle to get reliable information in regards to their health.
Definitely.
Right. Now, with the world of AI, yes, we will be using AI, but our AI is not providing solutions. Our AI is just a decision-guided tool whereby it provides an insight into what the users has put and prompts them to seek help from one of our vetted clinicians. You know, but when I say clinicians, I'm also including all healthcare professionals here, right? So we are not, it's not just, you know, people come in and say, it's got an AI tool. No, not at all, not at all. They will be speaking with real licensed healthcare providers. And we will also be partnering with different healthcare facilities in Lagos and outside of Lagos as well. And just to put it out there, because we are also calling out for partnerships, you know, from healthcare professionals, healthcare providers, research institutions, because we will also be big on research, NGOs, and different institutions that are committed into women's health. And if they do want to reach out to us, they could send us an email via businessgrowth@vivafemini.org.
Awesome. We'll talk about that now. I mean, it's our time. There are still lots of things to talk about with this particular digital health platform, because I know there are some other brands who have also tried to do something similar, but there are features that you've mentioned that stands VivaFemini out. But we don't have all the time. Hopefully, before that launch date of 12th January, we can still talk more and also intimidate the people more. But for those who want to, you know, partner, they want to also do the countdown with you, how can they reach out to you once again before we let you go this morning?
Well, thanks, George, once again for having me. And just to buttress that, we are quite key on access. You know, we want to ensure that we provide access to millions of women with preventive and primary care support. And we want to ensure that, you know, women have access to one ecosystem, you know, a trusted network of ecosystem using our platforms like labs, pharmacies, clinics, and all that. In order to sign up and get yourself ready for our launch date, which is due for January 12, 2026, visit our website, www.VivaFemini, that is VivaFemini.org, and just go to our join our wait list. And once you join our wait list, we are looking forward to having you, and we will be delighted that you've joined us towards our launch date as well. And for those looking to partner with us, you could partner with us via Business Growth, and that is BUSINESSGROWTH @vivafemini.org. And we will look at all of our requests for partnerships, and we will consolidate with the right contacts at you know, when we receive those informations or those requests. Awesome.
So for those who are sending questions over, just head over quickly to www.vivafemini.org. You heard the website right there. And for those who want to partner Business Growth at VivaFemini, that's where you can send your mail to. And I mean, it's not just for women alone. You're a man, you also want to keep track of all of these things on behalf of your woman. Why not jump on it as well? And yes, for partners, health professionals and consultants and stakeholders in the industry, this is an exciting innovation, and I must thank you especially Mr. Felix Bomide, his executive founder and the brain behind VivaFemini. Thank you for being a part of the conversation this morning.
Thanks, George. It's been an honor. Thank you.
All right. So, I mean, that's what we do right here. And you too. Having awesome conversations on EKO 89.7 FM. It's a Saturday morning, so we've done plenty talks. How about let's enjoy some good music right about now. This is a Ginika Chronicle. I've got a lot of interesting ones that are also on the lineup this morning. At the top of the hour, it's time for the